flu, glaucoma, bone fractures, fatigue, depression, autism, diabetes, pain, depression, liver disease. The CDC has determined that these ailments afflict over 1 billion people worldwide, all of which can be eradicated with the help of a breakthrough product that's changing the lives of practitioners and patients around the globe. It contains absolutely no chemicals or biological agents of any kind, yet it has been proven to increase the quality of life and wellness. It's the Aura Patch System.
You know, the Aura Patch is fairly easy to do. You have 10 patch, you have 1 month supply, it's easy, you take it out, stick it in, forget about it for 3 days and replace it. It has what, 35 plus programs in it, depending where we stand for. And it's very easy for the patient to do. It's not like remembering to take their pills about 3 times a day and take 16 of them, and one is blue, one is red, and I don't remember where it is. You stick it there, it's easy. And that's going to enhance the energy of healing, the vitality of the person, to be able to bring them to their 100% of healing.
Healing somebody, or the body healing itself, better said, is kind of like peeling an onion. You know, we talk about that in holistic care a lot because there's all these layers that you kind of have to peel through. And some of the top layers are going to be real quick moving. Like, you know, somebody comes in and they have something like Epstein-Barr virus. You know, Epstein-Barr virus is usually a virus that's feeding off of some parasites or some fungus or something else that's in the body. So we usually move pretty quickly, especially with the patches, we'll move pretty quickly through some viral situation or some bacterial situation. And then what I'll do is when I recheck, then we move from where we were to where we are. So protocol sometimes is going to change. You know, there's protocols for certain patches, like do this for 90 days or do this for 60 days. And I'm a little bit out of the box when it comes to that because I'm always rechecking. So if they don't need it anymore, we're moving on.
The patches are really just one modality we use. I do use several different energetic, we do energetic corrections here. I do another energetic modality, but the patches are really our #1 selling product, which is kind of surprising. We do a lot of, you know, digestive aids here and various other things, but the patches are our #1 seller.
What I like about Aura Patches, it's easy, and that's got to be important. I'm not really good at taking vitamins consistently, but there's something really easy about I can slip that Aura Patch routine into my morning, and it's every 3 days. It's not every day, and I find that I just use it. And I use different patches, and because of the results I've gotten, like I've used female hormone for a very long time, and energy, stamina, and then I kind of flip off on the others from recovery to kidney, adrenal, and organ cleanse, and those seem to help me a lot. And how they'll help me is with the energy. I thought that I did have more energy, and that I was able to control my energy better. With the female hormone, I really think it really helped me with my mood changes, and that one's been kind of a consistent one for me. And I have a lot of fibrocystic disease in my breast, and I think that's improved that as well.
I use the patches in combination with other therapies. I also use homeopathy, and I use herbs and nutritional supplements. And so I find I use quantum biofeedback to measure to see what the client's body is wanting. And so sometimes that may mean a combination of all of the above, or sometimes I have clients whose bodies prefer to use the patches, but it's nice because you can combine it with a lot of different modalities.
These patches are so easy for the patient to use and so simple to use. We just say anywhere above your waist on the left side of your body.
The patches are very easy to use. You peel them off, you put them on your person, upper left-hand quadrant of your body. They last for 3 days. You don't have to remember to take them 2 or 3 or 4 or 5, 6, 7 times a day, and yet they are constantly supplying the body with the frequencies, the good input that it needs to do the job that you want them to do.
You can put these patches on children, on animals. Really, I wouldn't see any contraindication for it.
I really like the delivery system. You know, it provides constant healing energy, whereas, you know, with homeopathics, you have to take them on a regular, consistent basis. So it's just a really good delivery system.
Most of the time we'll use the recovery. With most programs I use the recovery, and then I will add either 1 or 2 patches to that, because a lot of the people that I see have chronic issues, so recovery really works well for them.
The Aura patch was brought to my attention. We had a specific patient that was not getting any success with our treatments, which is frustrating for us because obviously we want to help our patients in every capacity. And I was very impressed to report 3 days later she had her first full night's sleep, and I became a believer in the patches. And I can say through the science and the research and the integrity and the research that Aura patches have done, I'm very impressed, not only with the sleep patch, but with the pain patches. And I'm impressed with the fact that they've had the ability to not only research, but to put in a very simple approach to helping patients for compliance, because compliance is very important. And when you talk to a patient about taking supplements, which is also important, sometimes patients don't want to do that. So the patches make sense for that individual.
We have people that can remember to change the patch once every 3 days, and they have 100% compliance on the program, and they receive the therapy of the program 24 hours a day. So we just think it's the very best way to service our product.
Because of the ease of it, I think that I'm consistent, and I've seen results faster through that than when I've tried just taking homeopathic medications or vitamins.
As a person gets on a program and is having success on a program and develops a good rapport with me and is willing to do pretty much what is necessary to get well, I then introduce the patch therapy in conjunction with their other therapies, and we've had remarkable positive outcomes.